Have you ever wondered where a bruise comes from, how it happens, how you got it? Well, bruises occur when you hit, bump, or run into something with a body part. Bruises are caused by traces of blood escaping from small vessels that lie close to the skin's surface. Some people bruise a lot easier, like elderly, because their blood vessels are more fragile. If you hit your head and get a bruise, you may have sustained a concussion and should be checked for head trauma. To reduce a bump and pain, you should ice the area for 30 to 45 minutes every couple hours. Repeat this until swelling goes down. If you do hit your head, make sure to watch out for excessive bleeding from an open wound, loss of consciousness, interruptions of breathing, prolonged disorientation, or apparent memory loss. If you do observe any of the following, the victim will need medical attention. Dial 911 and wait for the ambulance. While waiting for the ambulance, you should, if possible, place the victim in a dim, quiet area. Lay the victim down with his head and shoulders slightly elevated. If the wound is bleeding, dress it with gauze or clean cloth. Do not leave the victim unattended. If the victim's lost consciousness, you may need to perform CPR. That was great, Sylvia. CPR is very important and can save a life while the emergency vehicle is coming. When someone goes into cardiac arrest, their heart stops. Without their heart pumping, their brain can't get oxygen and eventually they will die. CPR works by being an artificial pump for the heart. When giving CPR, you should follow the pattern CAB. The single rescuer should begin CPR with 30 chest compressions followed by 2 breathing. Make sure to never leave the victim alone. Do not try to make the victim drink water. Do not throw water in the victim's face. Do not prompt the victim into a sitting position. Do not try to receive the victim by slapping him in his face. Before you start any rescue efforts, you must remember to check the victim for responsiveness. If you suspect the victim has sustained spinal or neck injury, do not move or shake him. Otherwise, shake the victim and gently shout, "Are you okay?" to see if there's any responses. If the victim is someone you know, call them out by their name as you shake them. The first thing you must do is check if the victim is responsive. You can do this by slightly shaking them and saying, "Are you okay? Are you okay?" If the victim is not responsive, you're going to have to start CPR using the CAB pattern. C is for circulation. In order to determine the victim's heart is beating, place 2 fingers on his carotid artery, located in the depression between the windpipe and the neck muscles, and apply slight pressure for several seconds. If there's no pulse, then the victim's heart is not beating and you'll have to perform chest compressions. When performing chest compressions, proper hand placement is very important. To locate the correct hand position, place 2 fingers at the sternum, and then put the heel of your hand on next to your fingers. Place one hand on top of the other and interlock the fingers. Lock your elbows using your body's weight compression to the victim's chest. The depth of the compression should be 2 inches. Remember, 2 hands, 2 inches. If you feel or hear a slight cracking sound, you may be pressing too hard. Do not become alarmed and do not stop your rescue efforts. Damaged cartilage or cracked ribs are less serious than loss of life. Simply apply less pressure and continue your compressions. Count out loud as you compress 30 times at the rate of 3 compressions for every 2 seconds, or approximately 100 to 120 compressions per minute, with a minimal pause between compressions. Chest compressions will supply blood flow to the heart and the brain, but if the victim remains unresponsive, you will need A is for airway. If the victim is unconscious and unresponsive, you need to make sure that his airway is clear of any obstructions. The breaths may be faint and shallow. If you determine the victim is not breathing, then something may be blocking his passage. The tongue is most common airway obstruction in an unconscious person. With the victim lying flat on his back, place your hand on his forehead and your other hand on his tip of his chin. Gently tilt the victim's head backwards. In this position, the weight of the tongue will force it to shift away from the back of the throat, opening the airway. If the person is still not breathing on his own after the airway has been cleared, you'll have to assist him B is for breathing. With the victim airway clear of any obstructions, gently support his chin so as to keep it lifted up and his head tilted back. Pinch his nose with your fingers tips to prevent air from escaping once you begin to ventilate, and place your mouth over the victim, creating a tight seal. As you assist the person in breathing, keep an eye on his chest. Try not to overinflate the victim's lungs, as you may force air into the stomach, causing him to vomit. If this happens, turn the person's head to the side and sweep any obstructions out of his mouth before proceeding. Give 2 full breaths. Between each breath, allow the victim's lungs to relax. Place your ear near his mouth and listen for air to escape while watching the chest fall as the victim exhales. Nosebleeds can be caused by many different things, such as a fall, strike to the nose, or even from breathing excessive dry air. If the nosebleed is not a symptom of a more serious injury, it's rarely dangerous and can usually be stopped by applying continuous pressure. You should have the victim sit up or stand upright to slow down the flow of the blood. Do not tilt the victim's head backwards. Loosen any tight clothing around the victim's neck. If possible, have the victim spit out excess saliva. Swallowing may disturb the clot, causing nausea. Pinch the nostrils shut. Press the tip of the nose against the bone of the face, maintaining pressure for 5 to 10 minutes. Once the bleeding has stopped, the victim should avoid blowing his nose, otherwise straining himself for at least an hour. If the victim's nose causes bleeding, or if the blood flow appears to be excessive, or if the victim feels weak or faint, the damage may be more serious than it appears. You should call 911 or take him to the nearest emergency room. A puncture wound does bleed less and is more painful. It has a high risk of infection. If you step on a nail or a piece of glass that has been exposed to the elements, you should go to the doctors in case you might need a tetanus shot. A bite from a household pet or another person that results in a puncture wound would be considered as a treated serious injury. If the bleed is heavy or the item that caused the wound appears unsanitary, thoroughly clean the injury area with mild antibacterial soap and water to seek professional medical assistance as soon as possible. If the injury is minor, clean it with soap and water and apply antibacterial ointment such as Neosporin to prevent infection. Dress the wound with sterile bandage and replace the dressing frequently. If the prudent to keep a close eye on the wound for several days to prevent an onset of an infection from any debris that may have lodged itself into the wound. If you notice persistent redness or puffiness or the wound starts to ooze pus, have the victim consult the doctor right away.